Welcome to Every Mom is an Athlete, the podcast where we believe motherhood is inherently athletic. From lifting car seats to chasing toddlers, your daily life is a workout. I'm Dr. Karlie, pregnancy and postpartum expert, sports chiropractor, strength coach, and mom of three. This is your space for strength, recovery, and real talk in pregnancy, postpartum, and motherhood. Welcome, Strong Moms. You're in the right place. Hello, Strong Moms. I'm so excited today to introduce you to Dr. Margie Davenport. If you missed it, last week we talked about exercise during pregnancy and what the research really says that you should and shouldn't be doing. So if you're pregnant, definitely go back and listen to that one. Dr. Davenport is an exercise physiologist and professor in the Faculty of Kinesiology, Sport, and Recreation at the University of Alberta. She was the chair of the 2019 Canadian Guidelines for Physical Activity through Pregnancy and the 2025 Canadian Guideline for Physical Activity, Sedentary Behavior, and Sleep through the first year postpartum. Dr. Davenport has published more than 200 manuscripts related to physical activity and sport during preconception, pregnancy, and the postpartum period. Over the last decade, she has worked with a number of national and international organizations, including FIFA, the Women's Tennis Association, the World Health Organization, the WHO, the International Olympic Committee, and these are just a few of the names on her very long list. Basically, you guys, if you want to know anything about research in pregnancy and postpartum, this is the gal you want to talk to. And I love our conversation. She is so easy to talk to. She makes this very in-depth research seem just so manageable and easy to understand and is just such a gift and a blessing for all of us pregnant and postpartum moms out there. So without much further from me, let's get into my conversation with Dr. Margie Davenport. All right, Strong Moms, we are back with Margie Davenport. We did a whole nother episode on pregnancy. So if you are pregnant or you have friends who are pregnant, please refer to that episode. It is so informative, all about what you should be doing, what's safe during pregnancy, just so much great research. So now we're going to talk about the postpartum phase. So Margie, would you just introduce yourself a little bit? Tell all of our listeners a little bit about yourself and how you got into doing all this amazing research for women.
So I'm a professor in the Faculty of Kinesiology, Sport and Recreation at the University of Alberta in Edmonton, Canada. It's a beautiful, warm, sunny day, even though it's the middle of winter, so I'm not really sure what's going on. And so how did I get into pregnancy and postpartum? A long time ago, more than 2 decades, almost 2.5 decades now, I was a national team athlete. When I retired, I really wanted to stay involved with sport and exercise. So I did a degree in kinesiology, and I got connected with an individual who was doing exercise during pregnancy and postpartum. I worked with her as an undergrad. And talking about postpartum, when I decided I was going to do my PhD, I wanted to fill a really critical gap. At that particular time, we had almost no research looking at the effects of exercise on postpartum health. And so I spent 4 years doing work specifically in that area. And strangely enough, it's only, now in sort of the early 2020s that we really started to understand a bit more about physical activity in the postpartum period.
Yeah, isn't that wild? It's just, I'm sure, don't get us started on the studies in women's health. Okay, wait, first I need to ask you, what sport did you do for the national team?
I was a synchronized swimmer.
Oh, cool. I was like, it's got to be something cool.
It was so fun.
Yeah, that's awesome. Okay, so tell me, I know you, like you said, you've done all this research. I know you helped release new postpartum exercise guidelines. So can you give us some of your biggest takeaways from those and, sort of break that down for the moms out there who are, planning to recover and heal and get strong again?
So I think the biggest take home that I want people to know about the new 2025 Canadian Guideline for Physical Activity, Sedentary Behavior, and Sleep throughout the first year postpartum is that it is not one size fits all. If you've been postpartum or you know more than one person who's postpartum, this makes perfect sense. But for the longest time, we have had this idea that, you don't do a lot in those first 6 weeks postpartum. You go and you get your clearance to exercise. And the next day you could go and run a 10K, 20K,
Crazy.
no problem. But in reality, that's just really not helpful. And so before we actually started the guideline, we spent about 6 months consulting with postpartum women to find out more about what they wanted to have in these particular guidelines. 2 key things, talking about depression and they wanted to talk about their sleep. This guideline is not about bounce back. This is not about getting back to who you were before. You're a completely changed person, having gone through pregnancy, labor, and delivery. And so really focusing on the idea that, you have an individualized gradual progression that's really based on your own individual symptoms, but gradually progressing towards 120 minutes of moderate to vigorous intensity physical activity spread over 4 more days of the week. Now, we do strongly encourage engaging in both resistance and aerobic activities, so walking and weightlifting, but also strongly encouraging pelvic floor muscle training as well, because we know urinary incontinence is so common in the postpartum period.
Yeah, there's so many things you just said that I think we could both probably geek out on for a long time, but we'll spare
Absolutely.
everyone else. So with all three of my kids, even my C-section, I had my middle son was breech and was planned C-section.
Mhm.
Even with him in the hospital, I was starting breathing and bracing drills like in the bed, right? And I always explain it to my moms that I see in my practice as like, you spend your whole pregnancy, right? And if you've been pregnant, your organs are shifted and your diaphragm is crammed and like that whole 360 breathing just is really difficult. And so what I find encouraging women to do is starting as soon as they feel ready, right? I felt ready in the hospital because fitness is a big part of my life and it makes me feel like me. And I'm not going to go out and like run or lift or whatever. So that is my fitness, quote unquote, right? Of like, okay, we're going to do 10 deep breaths with transverse abdominis engagement and, pelvic floor lift and all this stuff, right? So I guess, can you talk a little bit about the research as like, is there too early to start? Is there, you know what I mean? Like, and you can tell me if what I'm saying is incorrect. I'm still going to probably do it. But yeah, is there evidence around that?
Yeah, I love that question. So one of the key things that we were trying to answer is when is the best time
Right.
to actually start physical activity postpartum? Again, it is highly, highly individualized.
Totally. Yeah.
But there's a really big difference between what you were talking about with the breathing, a bit of pelvic floor, and the evidence that we have for those very early days, post C-section, post vaginal delivery, it doesn't matter, is engaging in movement. So
Yeah.
we're not talking about going for a brisk walk. That would be in the exercise realm. We're talking about mobilizing, getting up
Movement.
out
Yeah.
of bed, shuffling to the bathroom, and there's data now that suggests that engaging in 3,000 steps per day, that's a
Mm,
really low level of activity after a C-section is actually really going to enhance both your recovery, healing,
mm,
and it's really flying in the face of what we've traditionally told
yeah.
C-section moms, including myself, who did a PhD in postpartum exercise. I was in bed for 3 days after my C-section because that's what I was told to do.
Mm,
And so there's a lot of fear that you're going to cause harm. But if you think about any other major surgery, including abdominal surgery, everybody else is up and out of bed the same
yes.
day.
Yes. Oh, just mic drop. Yeah, that is super interesting. I do remember
Mhm.
I did overdo it, I will tell you this. After my C-section, I was in the hospital and because
Mhm.
you're on pain medication, right? Like I was
Mhm.
like kind of up and moving and my husband was like, "I don't know that you're supposed to be moving this much." I was like, "I feel great." And then the next day I was like, "Oh, I've overdone it." So now there's a
Mhm.
fine line, right? Like definitely a line of like, yes, 3,000 steps. I love having that number, because
Mhm.
it's a small amount really, but it's
Mhm.
more than nothing. It's more than just like stay in the
Mhm.
bed. And then it
Absolutely.
also for crazy people like me, it puts like a little kibosh on like, hey, that's still a small number. Like it doesn't need to be 5,000, 10,000. Like, no, 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 that's too
Mhm.
much, that early on, right? Those first couple days, especially.
Yeah, absolutely. But you know what? We've had so much emphasis on physical health, recovery, and healing that we
Mm,
don't talk enough about the importance of supporting our mental health in
yes.
the early days postpartum. So while you might feel like you physically overdid it from a physiological standpoint, there's a good chance that you were just going stir crazy and had to get out of bed, and
Mm.
that moving around and mobilizing was actually really supportive for your identity and psychological well-being.
Just a quick pause. If you're feeling like your body doesn't feel like yours anymore after having a baby, if you don't know where to start or you're tired of guessing what's actually safe postpartum, I've got you. I created the Postpartum Restoration Plan to give moms a clear, doctor-designed roadmap to rebuild strength, support their core and pelvic floor, and start feeling strong again. It's just 4 days a week, under 20 minutes, and built for real postpartum life. Whether you're a few weeks or a few years out, it's never too late to start. Click the link in the show notes and I'll walk you through it.
Yeah, I was just going to, great segue, thank you. I was just going to ask you about that because I know you started this off saying that the mental health and the sleep was a big part of this. So yeah,
Mhm.
tell us a little bit more about that as far as what the research is showing.
So I would say probably one of the most important findings of all of our work. So to support both our pregnancy and our postpartum guideline, we surveyed all available literature and we sort of put them together using statistical methods. And we're able to identify that overall being physically active in the postpartum period is associated with a 45% reduction in the odds of having depression postpartum.
Wow.
But the really important piece there is that we did look at the timing of the start of the exercise interventions. And we did find that if you started before 12 weeks postpartum, that you had even greater benefits than if you waited after 12 weeks postpartum.
Oh,
Now, in many ways, this makes perfect sense. Those
sure.
first 12 weeks, the fourth trimester, are a period where we have psychological vulnerability. We're certainly going to feel, most of us will feel some level of baby blues, but utilizing physical activity to help support your mental health early on is just so, so critical.
Yeah, that's great. That knowing that starting before 12 weeks is, I think, hopefully very helpful for people, because it's just so hard not having actually, here's a good question. Do you know where the 6-week thing came from? Like, do you know what, who, why? I feel like it's like the 10,000 steps. Like people are like, I don't know, stick a number on it. Well, call it good. Is there any evidence behind that?
So, yes and no, as best as I can tell, and I have gone digging through the
Yeah,
literature to see where this first appeared in medical literature. But 6 weeks seems to be a pretty appropriate tissue healing time. You're not
sure.
fully healed, but you're kind of healed enough that it shouldn't be terribly painful anymore. And yeah, anyways, fewer issues.
Mhm.
But that being said, you can have a vaginal delivery that takes a lot longer to heal than a cesarean delivery if you're
Mhm.
experiencing lots of tearing. Some people recover very quickly, and some people it takes them quite a bit longer. So the 6 weeks, as far as I can tell, is not based on any evidence outside of physical healing, general
Right.
timelines, which are important to acknowledge. But I think what often falls by the wayside is, again, our identity and our psychological health in those first 6 weeks.
Yeah, I think that is definitely something that's overlooked, right? And I always
Mhm.
tell people too, I tell a lot of my patients because so I've had one induction vaginal birth, one C-section, and then an unmedicated VBAC. People tease me. They're like, "You're so dedicated to your patients. You have to learn." I'm like, "I know all about all the births now. I had one of each." But what I always tell people is that the recovery is just very different, right? Like it's very
Mhm.
different having an abdominal surgery where your tissues are cut through and I tell them that in my experience it's more painful those first couple weeks, which makes sense, right? Because it's an unnatural way. I mean, we're grateful for it, but it's an unnatural way for a baby to come out, right? And so you have that tissue healing that needs to occur. And then I actually think personally it gets a little bit easier because your pelvic floor is generally still intact, although it has had pressure bearing down on it or throughout the whole pregnancy, of course. And then with a vaginal birth, depending on your tearing, right? Like you can feel great within those first couple weeks, or it can be a long, long road, as
Mhm.
you mentioned, as many women have experienced. So it all is just so dependent on so many factors, right? And so I always just like to share that because I think a lot of times, especially if women weren't hoping to have a C-section, they're a little bit worried about that postpartum recovery. And I'm like,
Mhm.
there are some benefits, that maybe it's a little easier in some ways, harder in others. So there you go. Take it with a grain of salt, people. Can you talk a little bit about sleep? I know you mentioned that earlier, but that's obviously for all postpartum moms, the
Mhm.
topic of the day, right? Is there research around sleep and postpartum recovery and exercise that we should know about?
Yeah, sleep is probably one of the touchiest subjects. So I had 2 kids. They were very poor sleepers, and so I've had this long-standing interest in sleep. You get to a point in the postpartum period where you're not functional, your brain is just not working, at least for me, my decisions were very poor often, and you get to a point where you just need to do something, and there haven't traditionally been a lot of options or supports. So when we went into the literature, what we found is that being physically active, engaging in moderate to vigorous intensity physical activity, it didn't do a thing for duration of sleep. You were still waking up just as often, but the really critical piece was that we found an improvement in overall sleep quality when women were actually asleep. And it's
Okay.
the quality of the sleep that you're actually getting that is associated with depression, anxiety overall. And so if you have better sleep quality, that you have a reduced risk of having depression and anxiety postpartum. So a really, really important thing to think about. We did a second systematic review to see if there was anything we could do to intervene on sleep other than physical activity. And there is, I would say, less data out there for sure. But there were just some really basic education about infant sleep. So, as somebody who my first daughter, I wasn't anywhere near family. I didn't have a lot of friends in the area because we hadn't been there very long, and certainly didn't know any other moms. But I had no idea what a tired baby looked like.
Mm.
And so just education about baby sleep signals, how to help them support the babies to sleep, that is also associated with better sleep for the mom, better sleep quality for the mom overall. So just a couple of important nuggets of information that I can think can help support sleep overall. That being said, I think that the education about sleep strategies needs to happen either before you become pregnant, during pregnancy. It is not something most people want to hear about in the early post period when they're in the throes of it. I certainly wouldn't have been receptive to it. So I think education early on is super important.
And I think, you know what I think happens too sometimes is it really takes women like you and I and like, people who are in this world, but also who have kids. We have to remember because I even found with my third baby, she's just one now. But I forgot. I forgot that a new mom doesn't know, oh, like she's
Mhm.
rubbing her eye. She's starting to get fussy and this is the sound she kind of makes. I was sitting one day and I was like going back and trying to remember, okay, what did I do? And I remember my son, my first son, my husband and I were like, we were letting him get overtired. So you're right. We just like, I think if we can go back and just remember some of those things and help those first time moms, especially, with some of those
Mhm.
cues, that could be really helpful. I want some more tangible things for our listeners. So let's say if a pregnant woman can do like two or three things consistently for her body, what would research support most that she should do during that kind of, let's say in that first 12 weeks, if possible, that fourth trimester?
So, a couple of things. So, I think the most important thing is mobilize, especially early on. If you're not ready to be physically active, some people are ready really early on, some people well past the 1 year mark. Both journeys are completely fine.
Mhm.
But mobilizing and not being afraid to get out of bed to walk around your house, I think is really, really important. There are going to be tangible benefits for your physical recovery, your mental health overall. The second thing, if you are ready to be physically active, certainly doing a graded return to physical activity is really, really important. You want to build those foundations first. Many women reduce their activity levels in pregnancy, and that is a completely fine, valid journey. But when we have that reduction in activity, you're going to have some detraining. And so when you do return in the postpartum period, building those foundations is really important before you start to do more intense or higher impact activity. And then the third thing that I strongly recommend is screening for contraindications
Mm.
postpartum. There may be reasons why you need to modify your activity levels. It's a very small subset of the population for sure. But again, we developed the Get Active questionnaire for postpartum, which can be self completed by the pregnant or postpartum women and make decisions about whether or not they have to go and get additional consultation with their healthcare provider before they be physically active.
And that's available online, correct?
Mhm.
Okay, yeah,
Mhm.
we'll definitely be sure to link those below in the show notes. You just said something that sort of reminded me. I remember one of my patients, it was also actually a good friend of mine. I remember telling her because she was a really good high level athlete. And I said,
Mm.
hey, I want you to know, she's a first time mom. I want you to know that that first week or two after you have your baby, you're going to feel the weakest you've ever felt in your life. And she later came back to me and said that was really helpful for her because I think it's surprising. I think it's surprising,
Absolutely.
and I explained to people, your spine is actually more stable with the baby in there, right? Then all of a sudden the baby comes out and now your organs have shifted and I don't like to call it a hole, but there's like a space, right? And your spine's not as stable. And so sitting up out of bed, all of a sudden, something that has never felt hard to you before in your life feels hard. And it's just very surprising. So I just mentioned that because I think sometimes knowing that makes you feel a little less like I did something wrong or something's wrong with me. Like, no. Everyone feels that way. And that's why you start with the breathing, with the bracing, with the stuff that I try to teach all my patients and I use in my programs. And you slowly, like you said, you build back that foundation. And then you get to do the more fun, sexy stuff. But you have to start with those basics.
Absolutely.
So I'd love to talk just a little bit before we let you go about the future of pregnancy care. What would you hope to see change, in the next 10 years or so because of some of this research?
There's so many directions to go. As I said in the last episode, a lot of my research is looking at more the extremes of exercise during pregnancy and postpartum. So we do a lot of work looking at women who traditionally have contraindications to exercise in pregnancy. They are told not to be active. There might be some evidence to support that, but in many cases, it's more theoretical than evidence-based. And then at the top end, when we have our high-performing athletes who really want to push the boundaries, they want to run ultra marathons during pregnancy. They want to lift, huge amounts of weight, and identifying whether or not it is actually safe, beneficial, or not. I'm not sold that it has to be every type of activity is going to be safe and beneficial. What I'm an advocate for is actually identifying the research so that we can provide what those risks or benefits actually are going to be. And so I think in the next 10 years, I really hope that we change the conversation on both ends of the spectrum. Same thing in the postpartum period, identify, what is sort of the best supports for people who are not really ready to be active early on versus those who are ready to be active the day after delivery. So really expanding the limits of what we currently know.
Yes. Well, thank you for all of your hard work in furthering that and, just helping put numbers to things and helping women feel confident on both ends of the spectrum, like you mentioned. Margie, it's so wonderful to chat with you. Will you let all of our listeners know where they can find you, where they can follow you so they can keep up to date on all this really important research?
So my website is exerciseandpregnancy.ca, and you can see the latest research coming out of our lab on Instagram at Dr. Margie Davenport.
All right. Thank you so much.
Thanks for having me.
Thanks for listening. Every Mom is an Athlete isn't just a podcast. It's a reminder that you're still the athlete you've always been. If this episode resonated with you, I'd so appreciate it if you'd share with a friend or leave a quick review. It helps more moms find the support and information they need. See you next time.